Talking about infections, you see, there is a thin line between bacteria and viruses. But many people seem to be on a quick fix side by hastily reaching out for antibiotics. After all, it's an infection, right? But do you know that both bacterial and viral infections often present same symptoms? So differentiating them and deciding on medications by yourself is not only very impractical, but may also be dangerous to your health. And now, hear this. The increase in this self-medicating habit, particularly on the usage of antibiotics, is becoming a global threat called antimicrobial resistance, AMR. I'm not trying to give you unprofessional advice here, okay? That's the reason in this report, a medical practitioner will enlighten us on the good, the bad, and the ugly of your frivolous intake of antibiotics. So welcome and thanks for joining me. Sit tight as I take you through this report on antibiotics.
Being sick and getting professional advice to stay alive is an inevitable part of life, as every human being gets ill at one point or the other, although the degree and type of ailment greatly differs. While there are some kinds of medical complaints that are generally believed to require only first aid treatments, some need general medical practitioners' interventions, while some need specialist physicians' involvement. Global response and concerns about the various kinds of ailments in existence also vary according to their seriousness. For example, there is endemic disease, which is a disease regularly occurring within an area or community. Malaria can be said to be in this category of disease. There is epidemic, when there is a widespread occurrence of an infectious disease in a community at a particular time. Examples of this are smallpox and measles. And also, there is pandemic, which is a widespread occurrence of an infectious disease over a whole country or the world at a particular time. Examples include, but are not limited to, cholera and COVID-19. However, some health-related concerns may not have originated from outbreak of diseases, but from spillover of abuse in medical breakthroughs, or simply put, drug abuse. Drug abuse is referred to as the use of illegal drugs or the use of prescription or over-the-counter drugs for the purposes other than those for which they are meant to be used, or in excessive quantities. In today's world, such drug abuse is rife, and one of such is the use of antibiotics. But what really is an antibiotic, and what is it meant to address?
So antibiotics are medications that are produced to treat bacterial infections. They usually work by killing or limiting the growth of harmful bacteria. So that means that antibiotics are used to treat only bacterial infections, and they wouldn't treat viral infections and others.
Resistance to antibiotics is now a global threat, so much so that the effectiveness of the medications meant to help fight bacterial infections are now resistant. In 2023, according to the World Health Organization (WHO), antimicrobial resistance (AMR) is one of the top global public health and development threats. It is estimated that bacterial AMR was directly responsible for 1.2 million global deaths in 2019 and contributed to 4.95 million deaths. Many people world over seem to reach out for antibiotics once a cough, flu, or throat infection, abscess, or the likes are noticed. But are antibiotics meant to cure all these? What really are they responsible to cure?
So antibiotics are recommended by healthcare professionals to treat infections caused by bacterial origin, which commonly, we can find in our environments, like urinary tract infections that are caused by bacteria, some sexually transmitted infections that are caused by bacteria, or skin infections like abscess, what we commonly call boil in this part of Nigeria, or cellulitis, or even some gastrointestinal tract infections like food poisonings caused by bacteria, some upper respiratory tract infections Even though some of them can also be caused by viral infections, but there's a way, medical professionals are able to differentiate which is caused by bacteria. Meningitis, like pneumonia, all of these are mostly caused by bacterial causes. And antibiotics essentially can address all these various problems.
What are the ripple effects of the abuse of the usage?
Sometimes it can lead to just having infections by overusing the antibiotics, because in our intestine we have certain microorganisms that are meant to serve good purposes. And when we overuse these antibiotics, it kills the good ones, now even leading to we having infections at the end of the day. So misuse of antibiotics is very bad because it can lead to antibiotic resistance, which is a very dangerous and has a bad future effect, even present effect on the entire healthcare ecosystem. So it's very important that we use antibiotics only when recommended and use only antibiotics with prescriptions.
The United States Centers for Disease Control and Prevention, CDC, in a 2019 report released in July 2024, estimated that antibiotic resistance continues to be a threat in the United States, with more than 2.8 million antimicrobial resistant infections occurring each year and more than 35,000 people dying as a result. How can this be nipped?
I would recommend that antibiotics or any medications, controlled drugs should only be dispensed by the pharmacist after they've seen a prescription. And I advise you, if you feel like you're unwell, make sure you go to the hospital and see a doctor. So the fact that you feel like someone close to you is taking a certain medication because of a certain symptom, it might be different for you. So don't share antibiotics. Make sure when you take your medications, and even if you feel well and you still have some doses left, ensure you complete it so that the medications work effectively and not just treat what the issue is currently. It also treats you as a whole and even prevent you from falling sick.
What can government do in this circumstance?
Policy guidelines are, it still boils down to quality control, from the prescriptions to the dispensation and the use of the drugs. So, it still has to do with, educating the population and ensuring the standards are there, which is why, we know when you are misusing or abusing antibiotics, there are standards as to which the antibiotics are recommended. Like I mentioned earlier, in Nigeria, the most common one is when people have diarrhea, they go quickly and pop a flagyl pill. All of this, when you let the people know that they're doing the wrong things, and they know the consequential and the long-term effect of this abuse of antibiotics, they know. So the standards are there, because it's really straightforward. It just has to do with we spending more time to counsel our patients and the population as much as possible. Just being able to give them relatable instances and letting them know what the consequential effects are.
Advice for the public.
Make sure you spread the right information, and you make sure you always take medications properly and forget about herbal medications that you're not sure about. Just only take medications and advice from something that you feel like that you can always fall back on. That if you go back there and you complain about the side effects, that they're able to help you and explain to you. And as long as you should always look at the expiry date of any medications you're taking. Make sure you're buying medications from the right sources, not just any chemist or random person you see around. Always look at these medications, because there are a lot of fakes out there. It's very important to always stay abreast with the right information and just reliable information. Sometimes people are very quick to share the wrong information on WhatsApp, and you see some older people just share that. So a lot of people are ignorant. You hear a lot of things where people are mixing this one and that one. So make sure you confirm this information. Go to a hospital. You get the right information from any hospital. Just stay healthy, and I feel like the best kind of medicine is fitness and health. So make sure you eat the right balanced diet and exercise regularly, get some rest, and just prevent falling sick in the first place so that you won't even need to take all these medications. Make sure you maintain good hygiene so that you don't have food poisoning. Make sure, we just boost our immunity as much as possible and just stay fit, and most likely you won't fall sick.
Now you know that antibiotic abuse can kill needed bacteria and do more damage to your overall health. The best you can do to help yourself is to visit a physician if and when you feel sick. So that's the much I can take on this edition of Talking Health with Bumi. Please follow us on all our social media platforms at Official Conga TV. Don't forget to like and share. Until next time, think health matters. Think Talking Health with Bumi. Bye.